Good morning, and welcome to the NCCN Product Theater, specifically discussing the work of the NCCN Foundation. My name is Patrick Delaney, one of your moderators today, and I have the privilege of serving as the Executive Director for the NCCN Foundation. And joining me today is...
Hi, good morning. My name is Dottie Shead. I'm the Senior Director of Patient Information Operations at NCCN.
Today, we're going to talk to you about the NCCN Foundation and the work we are doing around patient education and innovative cancer research. Later in the program, we'll be fielding your questions. So if you do have questions, we do encourage you to submit them throughout the program, and we'll address them at the end. For those at home, you'll submit those questions through the questions tab on your screen. And for those who are viewing live here at the conference in Orlando, please work with our colleague in the room, Jeanette, and she'll help you submit those questions live here in Orlando. For those who are not familiar, the NCCN Foundation serves as the philanthropic arm of NCCN, and we are charged to support two key program areas for the organization. First and foremost, our work is focused on the information and empowerment for people facing cancer. And you'll hear today all about the NCCN patient resources and what we're doing to provide those facing a diagnosis and their loved ones with the much needed information to address their disease realities. Secondly, we also support the advancement of innovative cancer research through the NCCN Foundation Young Investigator Awards program. As I mentioned, the NCCN Foundation is the philanthropic arm of NCCN. All the work we do in patient education and all the work we do in innovative cancer research through the Young Investigator Awards program is 100% supported through the generosity of others. So for those who are participating in this session today, who may have supported the NCCN Foundation with a grant or donation, thank you. None of what we do is possible without your help. But with your help, we are able to, again, provide education and resources to individuals facing a cancer diagnosis through our NCCN guidelines for patients and our other related resources that Dottie will share with you in a moment. Last night, we were privileged to hear from our 2022 Young Investigator awardees, where the NCCN Foundation is supporting early career investigators embark upon their research career. And then our philanthropy also supports general NCCN mission support. These funds are used to help us invest in future initiatives around education and access to the NCCN resources for the community. At this point, I'd like to turn this over to Dottie, and she'll take us through some of the patient resources that are available for our community. Dottie?
Okay, thank you, Pat. Good morning. I'd like to talk to you about our NCCN guidelines for patients. They are based on our clinical practice guidelines in oncology and funded by the NCCN Foundation. The guidelines for patients, we apply health literacy principles in order to make them easier for patients and caregivers to understand. These principles, we provide this information in clear, logical, and easy to read format. They are written using short sentences and paragraphs in plain language and active voice and a positive conversational tone. We avoid using all capital letters, all medical jargon, and numerical symbols. And of course, if we do use medical terms or acronyms, we define them and list them in a glossary in the back. So there are currently 71 guidelines for patients in our library, covering 56 treatment specific, covering 53 different disease types. We also have guidelines for cancer screening. These screening tests can help find cancer at an early stage before symptoms appear and ultimately improve outcomes by being able to provide care at the earliest possible stage. In addition, we have guidelines for supportive care, which is care given to improve the quality of life of people who have an illness or disease by preventing or treating as early as possible the symptoms of the disease and the side effects caused by the treatment of the disease. So supportive care includes physical, psychological, social, and spiritual support for patients and their caregivers. And I'm proud to say that NCCN currently offers 11 supportive care guidelines in our library. So the guidelines basically answer 3 questions. They answer first, what is it? So this section describes the type of cancer, where it is located, and how it spreads. This example in front of you is from one of our breast cancer books, but they all follow a similar format. They then go on to describe how the cancer is diagnosed. As you know, accurate testing is needed to diagnose and treat cancer and to have the correct treatment plan. So this chapter provides an overview of the tests that you may receive and what to expect. And lastly, how is it treated? So there's more than one treatment for cancer. So this section also describes treatment options that may provide the best outcomes for you and what to expect. The purpose of these guidelines is to have patients and caregivers on the same page and having the same information as their medical care team. So that is why they're based on our clinical practice guidelines. They encourage shared decision making and active patient engagement in their treatment decisions. We use images throughout our guidelines. Graphics and illustrations provide powerful visual tools that facilitate learning. These images enhance many aspects of learning, such as comprehension and recall, and make it much more visually appealing and holds the interest of our readers. There are other key features within the patient guidelines. At the end of each section, we list key points just to review and summarize what was discussed during that section. As I mentioned, there's words to know or a glossary at the back of each where any of the medical terms or acronyms are defined. Often people do not know what questions to ask their care team. So we also list questions that they may, just to get the conversation going, that they may want to ask so they don't go home and say, oh, I wish I would have asked these questions. We give them to people so they can take them with them on their appointments. And then, of course, we offer online resources from credible collaborators that we've worked with so people can find even more information regarding their treatment. The NCCN guidelines for patients are also translated. They are available in several languages for people around the world. We currently have over 73 resources available in several languages. And this is an area that I'm very excited to say that we are expanding starting this year. All of the guidelines that we update or develop will have a Spanish translation. And then several of our guidelines, including our lung cancer guidelines, will be available in multiple languages, 11 languages to be exact, at the end of this year. NCCN guidelines for patients have been recognized. We have independently for their ability to empower patients with cancer and caregivers. This is a list of some of the awards that we received in 2023. And in 2022, we were named the winner of Excellence in Cancer Patient Education from CPEN, Cancer Patient Education Network. So our guidelines, again, are free, and they are supported from funding from the NCCN Foundation. We have, again, just to recap, we have over 70 guidelines for patients, and that is expanding. This year, we're going to develop a guideline for small bowel adenocarcinoma and smoking cessation. We're going to expand our translations. Last year, we had over 1.4 million downloads from 1.2 million unique users. And you can access the guidelines from our website. You can download them free at nccn.org/patients or on our mobile app. And then if you would like a print copy, sometimes we have print distributions. You can check on our website. And if not, they're always available on Amazon.com for a small fee. In addition to the guidelines for patients, NCCN also has patient webinars. These are free webinars for patients and caregivers. They are live informational programs, 75 minutes long. They typically include a panel member or an oncologist with expertise on this disease type, a nurse educator, and a patient advocate. They are live programs, but they are also recorded and can be accessed on our website. And at the end of our webinars, there is always an opportunity for patients to ask questions. And lastly, NCCN has a patient resource card that you could register for online. It's a really brief question to fill out. And the resource cards have QR codes on them that you could hand to patients or caregivers in your clinic that it will take them directly to our landing page for our resources. Okay, thank you. Thank you very much. At the end of this program, we'll definitely respond to any questions. And now I'd like to turn it over to Delaney.
Thank you, Dottie. As I previously mentioned in my opening remarks, there are two program areas the NCCN Foundation is focused on supporting. You just heard from Dottie about our patient resources program. The second, I'd like to say a little bit more about, is our NCCN Foundation Young Investigator Awards program. So this is in this role, we're focused on supporting innovative cancer research. And this program is directed towards the NCCN member institutions when we invite proposals from junior faculty members within the NCCN network. The program itself is structured as a 2-year award with $75,000 per year awarded to the investigator and their institution. So over a 2-year period, the total funding to the institution and investigator is $150,000. Again, this is a program directed to supporting junior faculty at NCCN member institutions. So our request for proposals for this program is submitted released only to NCCN member institutions. And then we at the Foundation partner with the NCCN Oncology Research Program to facilitate the RFP. So again, just from a clarity of how this process works, we at the NCCN Foundation are responsible for generating the funds necessary to fund the NCCN Foundation Young Investigator Awards Program. And then we collaborate and partner with our colleagues at the NCCN ORP. They will help co-facilitate the request for proposals with the foundation. They will recruit from our member institutions the selection committee members, which again, that committee is comprised of one expert in their field from each of our member institutions who will review the proposals that come in any given year, score them consistent with NIH standards, and then we award the top scores based upon the funding that is available in that given year. So we do this selection every spring. Excuse me. We just literally met for the 2024 awardees, but that information is not yet public. So I do want to celebrate with you today last year's recipients. We did have the funding available to present 4 Young Investigator Awards, and you can see the recipients therein. For those who attend the NCCN annual conference, there is an annual Young Investigator Award oral poster session, which, as I mentioned earlier, was held last evening for our 2022 awardees. So if you come back to our annual conference next year, and we hope you do, you'll see these 4 young investigators present their oral poster sessions as they're wrapping up their 2-year award. Again, we had just selected the 2024 awardees, and they are still being notified as we speak. But I will share with you, I'm very proud of the fact that this year we had funding available to fund 5 full awards. So we're seeing some growth in the program for 2024. We have a lot of points of pride here at the NCCN Foundation, so I'd just like to share some of them with you today so you can see the work we're doing, but also the impact we're having into the cancer community. So within the NCCN guidelines for patients work that was done in 2023, you heard Dottie mention we had over 1.4 million downloads of the patient guidelines by more than 1.2 million people. It is important to note that just under 20% of our users last year were from outside of the US. So while the NCCN and NCCN Foundation are US based, our reach is certainly global. Last year was our busiest year in maintaining the patient guideline library. We updated 29 of the existing patient guidelines, which again was our highest year ever. And we developed 6 new books last year. So we have those 6 brought our total up to 71 books. And as Dottie mentioned, we have a couple of new ones in development today. So we'll minimally be 73 by year end. Last year, recognizing that language is an access barrier, we increased our commitment to translation of the patient guidelines. We added 31 new language translation resources to the patient guideline library in 2023. And I'm extremely proud to say that currently, as we sit here today, there are 50 translations already funded and committed in the pipeline that will be posted by year end. And we're hoping for much more. Dottie mentioned about the webinars. Last year, we hosted 6 free webinars. These webinars, again, are live through a video process, but they're recorded and made available on our YouTube channel and the NCCN.org website for future viewing. And last year, those 6 webinars had 2,500 plus live attendees. Again, these resources are all available free of charge digitally, but for those who wish or require a print copy, when we have funding, as Dottie mentioned, we are able to provide free print copies. Last year, over 25,000 copies were made available. Our work does not happen in a bubble, and we're very excited that we can continue to partner with patient advocacy groups, and we increase the number of collaborations to over 210 advocacy organizations who are helping to share these resources with their patient communities. And then recognizing we needed to increase our efforts to get these free resources into the community beyond our current connectivity through healthcare systems and through our advocacy partners. Over the last year and a half, we've been focused on increasing our reach by using the resource card, which is going outside of oncology into other government and non-government systems, other corporations. We've had a targeted approach working with and through employers to help bring these resources to their workforce and their dependents. That work last year allowed us to increase our reach and awareness of these resources to over 1.5 million people. I used the word a moment ago about access, and that is a key reality for us. We always want to make sure that while these resources are developed, we're ever increasing the access opportunities. So you can see on the left side a number of our ongoing access, making these resources available, again, free of charge through our web and our mobile apps, our print distribution, but again, some other ongoing initiatives with employers, language translations, and et cetera. Some new things that are under development right now, either we launched last year or we're continuing to develop and will hopefully launch later this year, is increasing our attention and expansion at a global front. We're looking at doing more targeted advertising, especially to reach those communities that are facing access realities, access challenges, I should say. We are exploring right now hosting a clinical trial webinar to educate and inform the community and reduce the myths surrounding clinical trials. We're ever increasing our work around employers and have been stepping up that effort to make sure that we're getting people where they are and where their benefits are typically coming from. We've also been piloting some additional ways of print distribution to get these printed copies into the community in different ways. We just launched a new arrangement now with SolarSpell, which is an organization providing an offline digital resource to communities that do not have internet and or electric access. And we have a new collaboration that will launch soon that is going to support the Hopi tribe in northern Arizona. And then, as you heard Dottie mention, language translation continues to be a priority. The commitment we've made to every book having a Spanish translation within 60 days of the English version posting is something, a commitment we made last year. However, I just got word late yesterday, the first of those projects, we got the translation in yesterday, so we expect that translated book to post this coming week, and that will be the new norm for the NCCN Foundation moving forward. So as we conclude our remarks, there's a couple of points we'd like to make about how you can help. Again, everything we do here at the NCCN Foundation is done through the generosity of supporters and the strong collaborations we have with people in the community who are seeing patients, treating patients, supporting their employers, et cetera. So please, those of you participating with us today, you can help. You can help by raising awareness of these free resources, by sharing them at your institution, connecting them with your employer, helping get them out to a loved one in a time of need. We really rely on everyone being a referral partner, so please, we definitely ask for your support. And again, everything we do is only made possible because of the generosity of our supporters. So if you or your organization has the ability to support the work of our foundation in patient resources and cancer research, we would very much appreciate and welcome donations of any size, any type. If you'd rather discuss it with us, we're more than happy to have a conversation with you to help make that a reality. And in closing, just an open invitation. If you have questions about anything you've heard here today, If you'd like to learn more about how you can share these wonderful resources within your organization or community, and or if you'd like to learn more about how to make a donation in support of our work, you have my credentials in front of you. Please call me, please email me. We welcome the opportunity really to make new partners and help bring these resources and support these resources to those who need them. With that, this closes our formal remarks. Thank you for your attention. We do have some time for questions. So at this point, Dottie, I'll see if do we have any questions in the chat? Or not the chat, excuse me, in the online question tool.
I do not see any in the online question tool. And I'm looking in the chat now also.
Well, I do see that one. So there is a question. Patrick referenced the philanthropic support for these resources. Where do the funds come from? So we are a foundation that receives funds from multiple sources. We receive grants. Grants come from community or family foundations, grants from the pharmaceutical industry. We receive donations from individuals. We also receive donations from corporations. So we are an all-inclusive foundation. We will accept any generosity of any size or methodology. So if you know of someone with a charitable budget at their employer, if you are connected with a foundation, or if you're in the pharmaceutical industry, the chances we're probably working with you. But please, again, reach out to me, but we're more than happy to have a conversation.
Okay.
So there's a question here that the person is familiar with the NCCN firewall. How are the patient guidelines developed in lieu of that? So Dottie, would you like to address the firewall and where patient guidelines exist within relation to that?
Sure. So the NCCN patient guidelines are developed based on our clinical practice guidelines, which are protected by the firewall. So their deliberations and the content in them is strictly decided by the discussions of our panel members who are reviewing the evidence and consensus for each recommendation. Therefore, anything that is within our patient guidelines is the direct adaptation or derivative from the recommendations in our clinical guidelines. We do not include any outside information or recommendations. It must be in our clinical practice guidelines to be included in the patient-facing resource.
Thank you, Dottie. So the way when I'm talking with funders and donors, the way I describe it is what is included in the patient guideline originates in the clinical practice guideline. What Dottie and her stellar team of medical writers do is they adapt it to how it's communicated. So in essence, the methodology we're communicating to the community, which is why for those who work in industry and are familiar with the firewall, which is why the foundation can and very gratefully accepts funds from pharmaceutical industry, because again, which is not possible, by the way, with the clinical side of the house, but because we're not developing core content, we're simply adapting it for the community understandability. Please don't be shy if you have questions. You were kind enough to get up early on a Saturday morning, and we're very grateful for that. So if there are other questions, please put them in the chat. I'm sorry, in the online tool, using the tab,
The Q&A tab.
the Q&A tab if you're remote, or working with our colleague Jeanette if you're in the ballroom here in Orlando.
And if you are in the ballroom here, after this presentation, we will come around to say hello and greet you as well.
Well, we don't see any other questions in the queue. So again, on behalf of Dottie and myself, just want to say thank you so much for joining us today. We hope that you've learned something about the NCCN Foundation and the work that we're doing to support people facing cancer, both through education and empowerment to drive towards shared decision-making, and also by investing in early career investigators that really are the future of cancer research. We appreciate all of your time for those supporting our work, whether it be financially or through referring our resources to others. Thank you. This work does not happen without all of us. It truly does take a village. Thanks again for coming out. Please, if you have any questions or want to learn more following today's session, again, my credentials are on the screen. Don't be shy. We welcome your outreach. Thank you.
Thank you very much for your time.